Now, you say bone grafting, especially when we're talking about dental implants, is not something to be afraid of, that it's improved, that it's not a big deal. I don't want to put words in your mouth, but you say it's fairly routine in your practice.
Yes, it is very routine. And the biggest problem with bone grafting is patients have misconception of it. They confuse one type of bone grafting with the other kind, there are more than one kind of bone grafting. So unless and until you know what kind of grafting you need, you cannot you don't know what kind of procedure you need to get. Some of the grafting, most of the grafting, majority of the grafting we do in our practice are very simple. Just like getting a tooth removed, the post-operative pain and the recovery is very similar to getting a grafting.
Like synthetic materials?
Yes.
Build bone, or what do you do?
Yes, absolutely. We use 3 different kind of materials. We use a cadaver bone, which is from another human who's dead. It's sterilized. It gets from a bone bank. So it's all tested, there's no disease in it. So it's a cadaver bone. Second is a synthetic bone, which is calcium mixed with phosphate and other organic and inorganic materials. And the third one is a xenograft, which is also a bovine bone, right? But it is also sterilized, it's also tested, no disease in it. But those are the materials which we use to build the bone, and it works.
Does it hurt? I mean, because that's what I hear about bone grafting. It's a painful thing.
It's not. It's just like getting a tooth pulled. Like I said, most of the dental implant surgery and the bone grafting, the post-operative pain is very similar to getting a tooth pulled. And the patients who need this...
So a little sore, that's about it?
That's about it.
They don't feel anything during the procedure because they're numb, right?
Yes. They're numb, and sometimes they're sedated. If they prefer to get sedation, they're sedated. So they don't even remember that they got the grafting done.
Now you've taken, we should mention, you're a continuing education fanatic. I'm calling it, more than 500 hours on just dental implants. So this is all you do. You've done a lot of bone grafting.
Yes, I do a ton of bone grafting. I do that routinely in my practice, and we need to do that in procedures. And the problem is the patients self-diagnose themselves. They think once they need the bone grafting, it's a big deal, and then they try to talk themselves out of doing a procedure which they didn't want to do in the first place. Now the bone grafting is making it more difficult for them to get it, but it's not that difficult. It's a simple thing.
It's easy.
It's easy. It's just part of getting a procedure done. It's just one additional thing, but we can do it very proficiently, very efficiently with minimal pain in our practice.